This is the annual scientific sessions of the Heart Failure Society of America. It's a meeting where healthcare professionals from all across the country, as well as internationally, come to share information and to learn from each other in terms of how to take care of our heart failure patients.
I enjoy coming to the HFSA meeting every year because these are my people. These are the people who care for and research and try to help out patients with heart failure.
I come to HFSA to not only reconnect with colleagues and friends and mentors, but meet new people and of course learn about advances in heart failure so that I can take this back to my institution and really practice evidence-based medicine.
I think the energy at this year's event is spectacular, and it's really following on the heels of 3 years of pandemic restrictions that have really limited our ability to interact as a community.
This year, I think people feel more comfortable. People have taken off their masks. There's a lot more people. We're interacting, and so the energy level is definitely higher.
It's wonderful. I think it's a lot of pent-up energy. We've been apart for 3 years. There are many people I haven't seen for 3 years, and I think we are more than excited to be back together again.
I'm so glad we're back to in-person conferences. Just every day, something new to do, some exciting things you can meet up with friends and really learn from everyone around you.
We have fantastic educational sessions throughout that actually address each level of the experience for the providers.
And it is an opportunity to really engage with the leading edge of what is new in the field and understand how it is that that new science will impact day-to-day clinical practice.
I think they did an amazing job to have a really multifaceted, yet targeted and relevant delivery of educational sessions for everybody.
We get to hear the latest guidelines, the updates, the things that matter to patients, from drugs to devices to patient-centered outcomes.
The networking that occurs at this meeting is also an essential component because it allows us to expand beyond our own little silos.
For those of us who practice in the space, it's an opportunity to meet with colleagues, to establish collaborations for research and clinical care, and also to develop friendships that have really formed over years in this field and to renew them with in-person engagement.
If you're interested in networking, meeting people, and building relationships, you can't do that over virtual. You got to come in person, and there's a very warm environment here. People want to meet each other. There's nothing like being here in person.
Just that face-to-face conversation, the face-to-face meeting adds a whole depth and makes all this more meaningful.
I'm really looking forward to seeing all of you in Cleveland. It's going to be a fantastic meeting, as it always is. Hope to see you there.